We're going to get started today with a simple stretch series that we can all use when we're feeling stressed. We all hold stress in different places in our bodies. A lot of us will notice tension in our jaws, our neck, our back, but our hips and our pelvic floor can be a spot that we store a lot of excess tension as well. So we're going to start by getting into those hips, getting them moving again, trying to tune into our breath, and really make some space through our pelvic floor. So first and foremost, we're going to just start with some gentle movement. So go ahead and make your way into 4-point with me here. On your hands and knees, finding that nice quadruped setup. Start by just simple rocking back and forth, setting those hips right and left. We're going to try to increase that speed a little bit. Think like you're wagging your tail. Try and release any tension that you find as you just increase that speed little by little. Little and quick, alternating right and left. And then bring yourself into a pause. Let's draw some circles with our hips next. So big inhale, draw a circle, wrapping around through the tailbone. Trying to be nice and free with the movement here. You don't want to force it into your lower back. We don't need to go way up and feel pinching in our spine, so just keep it nice, loose, and free. And go ahead and go the other way. Sometimes we need to be a little bit playful with movement to try and let go of things that we've been holding really rigid and really tight. For those of you that walk around and are constantly clenching your butt, you are feeding into that pelvic tension. So we want to do our best to try and shake it out, let it go. If you catch yourself brushing your teeth, you're standing at the countertop, you're doing dishes, standing at work, whatever it might be, when you're there, literally shake out your butt. It can do a lot of wonders for your pelvis. Let's go into some rock backs. Next, we're going to work on lengthening through our hips. So I've got my hands and knees again position. Take a big inhale, reach your tailbone for the wall behind you. Exhale, come back forward. Inhale, reach that tailbone back. Exhale, come front. Inhale, rock back. And exhale, come forward. Trying to keep that back nice and long and flat, moving through your hip joint here. You want to see that angle change in the hips. But the back stays long, so we're not rounding our spine, staying long and flat, hinging through those hips. And do one last big stretch, come back up. We're going to move and add a little extra element here. So grab a book, a pad, a pillow, throw it under one knee. Come back to your 4-point position here. I want you to rock back into the side now. So not straight back, we're going back into the side. I feel this really nice stretch in the outside of my glutes. And then I'm going to come back. Inhale as you go back. Feel that nice stretch. Exhale, come out. This is a nice way to help to create some internal rotation inside of your leg, so that we can work on lengthening out these deep rotators in the back of our hip here, that deep achy butt pain we all get, trying to get some of those muscles that thread through the pelvic floor in those deeper layers to let go. For those of you that are like squatting and doing deadlifts all the time and you're squeezing your butt cheeks at the top, things are probably feeling a little tight and spicy back there. We're going to move over to the other hip, slide that pad over, come on right back down, rocking now towards that pad. Feel the stretch on the opposite side. So now that we're separating out our sides, right and left, do you notice one side feels more tight and tense? I do. My left hip, this one that I'm working on right now, feels a little tighter than my right. So I might do a few extra reps on the side, trying to focus on evening out, thinking about big inhale, send that breath towards my tailbone. Easy exhales, trying to say hello to that tension, leaning into it. Do one more here. I'm going to ditch my pad, and I'm going to go into another variation here in 4-point. So go ahead and kick one leg out to the side. We're going to rock back into a half frog stretch. So you can do a few with me here. Inhale, rock back. Exhale, rock forward. We're starting with these rocks. We're going to progress into some longer stretches, but we want things to be nice and warm and limber before we worry about doing long holds. So inhale back, exhale, come forward. I'm feeling this stretch now in my inner thigh. Feels really nice. I'm going to drop down now with my hips back into almost a puppy pose. This can be a really nice relief position for anyone dealing with a cystocele. That's a bladder prolapse. So I'm going to come down in this puppy pose here. And now I'm going to add a little bit of a shake like we practiced earlier. So just shaking out through your hips. Sometimes that little bit of vibration, that little oscillation, that little shake helps us let go of a little extra tension. And then I'm going to settle into my stretch and take some nice deep breaths here. See that expansion into my lower back, into my belly. Easy exhales, big inhales. Starting to settle down into the stretch now. Go ahead and bring yourself back up. Rock forward for a second, reset yourself, shake out those hips a little bit if you need to, and we're going to go one more time into that stretch. Big inhale, big exhale, sinking in. Notice if it's getting easier to melt all the tension that you're feeling between your sit bones, around your tailbone, around your stomach, that inner thigh, your lower belly, and your pelvic floor all have the same nerves coming down telling them to do work. So when we're constantly clenching our butt, clenching our pelvic floor, squeezing in our belly, squeezing our thighs, we're feeding into this system of tension that can result in pelvic floor tension, which can contribute to leaking pelvic pain. Go ahead, bring that leg in. So we want to make sure that we're taking the time to take care and stretch all these muscles, tune into them, and get them moving again. Let's go to the other side. Stick that leg out, starting again with those gentle rocks. Inhale back, exhale forward. Feeling that stretch in the inner thigh, maybe a little in between those sit bones too. Getting nice and easy rocking here. Inhale to reach your hips back. Exhale, roll forward again. I'm going to do just a few more bobs, and then I'm going to drop nice and low into the puppy variation here, bringing my chest and my head down, going down on my forearms. Coming down here. You can add a little shake to it if you need to settle into that stretch a little bit more, shaking through your pelvis, shaking through your hips, and then ease into your stretch. Big inhale and easy exhale. Breathing, softening into your tailbone. Feeling that pelvic floor just relax and fill like a balloon with air. We're not bearing down, holding our breath. We're just breathing into your pelvis, breathing into your tailbone. Soften all that tissue. Big breath again. Go ahead and bring yourself up. Shake out a little bit again if you need to. We're going to go into that puppy variation one more time, dropping in. Rock those hips back till you feel the stretch in the inner thigh, in between the sit bones, by your tailbone. Breathe into your booty, breathe into your tailbone, whatever cue helps you soften. You could even reach one of your hands back. Feel that space right around your sit bone here. When you breathe in, you should feel that tissue push a little bit towards your bottom. And then you can feel that expansion, that gentle filling of air. It might help you feel a little bit more aware of what's happening in your body. Good. I'm going to push myself up. Bring that leg back underneath me. I'm going to go onto my back now. We're going to work on opening some more into the back of the hip in our piriformis next. So make your way onto your back. Figure 4 position here. So bring one knee over. Grab the lower leg, pull towards your butt. You want to feel that, or pull towards your chest. You want to feel the stretch in your butt right here. Taking some deep breaths to soften into this area. Easy breath. If you find that it's really hard to relax into your stretching, sometimes it helps to do a little lip trill or a hum. So you could breathe in, fill everybody with air, and then lip trill. Easy on that exhale. Breathe in. If the lip trill is not for you, try to hum on your exhale. Whatever helps you. If this stretch is too intense, go ahead and lower that leg to the floor. Try pushing the leg away from you instead. Again, you want to feel the stretch in the back of the hip. So whether it's here or here or here, it's where you feel that moderate intensity of stretch. We're not going for super intense. We want it to be moderate in the middle. Couple more deep breaths, softening around the back of the hip there. Last one. Let that foot come down. We're going to trade legs, crossing the other ankle over the thigh, pulling in towards your chest, or keep that heel on the ground and push the figure four leg away. Breathe in. Softening everything around your pelvic floor, around your tailbone. Feeling the stretch in the back of that hip. This is your piriformis muscle. This muscle is one that pierces through the pelvic bowl, is part of the pelvic floor. It helps to rotate the hips. It has a lot of jobs. It's one that tends to get tight in a lot of us. Great to work on stretching. After being here for a minute, I'm starting to feel that muscle let go a little bit. I feel like I can go a little further, taking up some of that slack so that I stay in the moderate stretch range. Big breath in. Sending that air down towards the stretch, which feels really nice. I'm going to do one more big breath in. Bringing my feet to the floor for a moment, and then I'm going to pull myself into happy baby. So grabbing the outsides of my feet, going to pull towards my chest. Taking some deep breaths now in. Feeling that expansion of my entire pelvic floor. So not just in the back by my tailbone, but from back to front. Feeling everything expand as I take my inhales. And the lip trill on my exhale here. You can even add a slow, easy rock to move those paraspinals a little. Or just hang out here in the middle with me. Whatever works for you. Nice midline stretch, getting both sides moving here at the same time again. Tuning into our bodies. Last big breath in. Let those legs come down. And you're going to turn, get yourself up against the wall here. Get your butt as close as you can. It can be a little bit of work to scooch in. You could also add a pad if you want to get your hips up a little higher, if you're somebody who's dealing with a lot of prolapse. Bring those legs, mirror's in my way. Bring those legs wide. And you may be able to go further if you've got a little more real estate than I do, but I want you to feel the stretch in your inner thighs here, in your pelvic floor, taking a deep breath in. You can put a hand on your chest, hand on your belly here, and feel that nice even expansion through both. Belly fills, chest fills, and then on the exhale, they settle back into their resting positions. Big breath in, feeling everything fill with air, and then exhale. If you're feeling a hard time getting the breath to come down towards the pelvic floor, you can reach and feel and palpate anywhere in that pelvic floor area along the vulva and feel for expansion there as well. This can be a really nice prolapse relief position, especially if you are having a retrocele. And if you are feeling like you have a utrocele, which is where the uterus comes down. So we did puppy pose, facing the ground when we have a cystocele, because gravity is going to help to pull that bladder back to where it should be. This helps better if we are dealing with part of the rectum pushing forward, or we're dealing with the uterus sliding down. Okay. Couple more deep breaths, softening that tissue, feeling the stretch in your inner thighs. Bring those legs in together, slide down the wall. If you've got the pad underneath you, go ahead and slide it out. Turn around here. We're going to go into some breathing. Scooch in nice and close to the wall so that you can have 90-90 in your knees. If you want to put a little ball between your legs, you can. Reach your arms up nice and high here. Take a big full inhale. Breathe into your belly and pelvis. And then exhale, scooping up and in. Send that breath low. Exhale, scoop up and in. Breathing in, nice and low again. Unfold my pants here so you can see the expansion a little bit better. Breathing nice and low. And exhale, scooping up and in. Nice and flat belly at the end of that exhale. Breathing into the back, belly, and sides. Get that nice big expansion. Feel that pelvic floor reach. And everybody is coming back in together again. Bring that ball in towards your chest. Feet come down, roll to your side. Find something nice and sturdy. We're going to go into a nice and deep squat. I've got the bars around the room in here, but if you don't have bars, you can use your countertop. Keep your heels down on the floor. Settle in into that nice, easy stretch. Kind of rock it out. Breathe in here. Feel your lower back fill with air on each inhale. Feel your tailbone expand to the floor. Creating that space through your pelvis. Creating space in your lower back. Getting that deep stretch into your hips. Two more breaths. If you're feeling vulnerable when you do this, you can always bring your ball underneath to support your pelvic floor so that there's a little bit of support to the perineum so that you don't feel that downward pressure. I'm going to take my ball out, lower myself slowly onto the ground, and then come back to 4-point where we started to finish out again. See how you feel drawing those hip circles again. Is it a little bit easier to move? Try the other way. Come into some shakes. Do you notice that it's a little easier to get a little bit of wobble going? Can you rock back with a little bit more ease? I know I feel a lot less tension. Needed this after a leg day. Recording this around the holidays, so it's stressful times. So I hope that this helps you as much as it helps me when I'm feeling a lot of tension in my pelvic floor. Of course, lots of internal work can be very helpful as well in the beginning, whether that's therapy or with a pelvic wand if you've been trained. It is so helpful. It's worth taking the time to work through that hip tension to get that pelvic floor moving, focusing on melting tension in your jaw, in your shoulders, and everywhere else as well, because when we clench in one spot, we're likely to clench in others. So as you go through the day today, check in with your booty a few times, check in with your jaw a few times. If you catch yourself clenching your booty, shake it out. If you catch yourself clenching your jaw, try to do some of those lip trills. Melt that tension in your jaw. Happy holidays, everybody. I hope that you are staying stress-free and that this is a helpful program for you.